go clockwise. But if you know there is a lump, then you may do superficial palpation on all sides and then go from non-lump area to the lump area so that you know that this is where it begins. On percussion, just so you know that flexor and fleximeter, the finger that you put on the patient is fleximeter, this is flexor. Movement should only be at the level of wrist. Normal notice, you can find it all over the abdomen. On auscultation, the normal call sounds are low-pitched, gurgling in character and about 20-30 per minute. Okay? Fine. For abdominal examination, these are the basic things. Regarding specific lumps, I believe you can read for them. Long cases, I've taken few, the commonest one inguinal hernia. Age is important, younger is indirect, older is direct. I think you all by now understand the fundamental difference between a direct hernia and an indirect hernia. May I assume that? Am I right? Yes? Okay. Always say swelling in the groin. Okay? In the first history, don't say swelling in the inguinal region, say swelling in the groin. The history may be that it appears or it disappears on its own or it is reduced. You plenty of times you will find patients who will say that I can push it inside again. Pain. So when does pain occur in hernia? In the initial time of development, right? Because when the bowel is trying to get out of the abdominal cavity, there is pull on the mesentery, root mesentery, which is causing pain. But as the abdomen, as that bowel gets used to being pulled in the hernia, usually that pain disappears. That pain would be in the abdomen. It would not be on the hernia. It would be in the abdomen. And it would be dragging kind of pain, right? Acute pain, complications, you know, it's irreducibility first stage, obstruction second stage, strangulation third stage. So what other histories would you ask for? So if you go to Love and Bailey, it says that increased abdominal pressure is only a probable cause of hernia. Okay, it is not the cause of hernia, but it reveals the hernia. So you would want to ask any episodes which cause increased abdominal pressure. So you remember 3 orifices. So patient may cough, patient may have trouble with urination, or patient may have trouble with defecation, and then accordingly you can ask all the symptoms. These are the ones that you are expected. Now consider fever, unrelated symptom. So don't ask them. Fever, if you ask in case of hernia, now in a PG case, that person may be able to justify one or the other. But you don't want to do that, right? What's our aim? Our aim is to clear the exam, right? So inguinal hernia, now this is true, whatever I have written is true or rather recommended for any swelling. So when you describe a swelling, again don't do bullet points. That the size of the swelling is 4 by 4 centimeters, the shape of the swelling is globular, the swelling is no. It should begin with a single globular swelling of approximately 4 cross 4 centimeters is present in the right groin. It shows the examiner that you know how to speak. It also talks about confidence. And then if at all your examiner wants to find something and ask you a couple of things, then he or she may ask you. So describe in a single sentence. Examination, you please, in long case, you have to say that I